In low and middle income countries around the world that are becoming more prosperous, silent killers lurk, threatening to undo years of progress. That threat comes from non-communicable diseases and conditions such as heart disease, stroke, cancers, diabetes, chronic respiratory diseases and injuries. Together, these are the leading causes of death around the world.
These diseases are responsible for 38 million deaths every year, and this is 60% of all deaths in the world. It's important to note that 80% of these deaths occur in low and middle income countries. Injuries account for an additional 10% of global deaths. So together with non-communicable diseases, these conditions account for 70% of all global deaths.
The cost of treatment and health care for these diseases and injuries is very high, and it threatens to overwhelm healthcare systems in developing countries. In addition, these diseases often weaken the workforce in a country, so the impact on productivity and the economy is tremendous.
You know, you find out that you've got a heart condition, you lose 50% of your heart capacity, then you're told that you've got diabetes, and then you're told that you've got cholesterol. It's quite a large amount of information to digest in one sitting.
Heart diseases, stroke and diabetes reduce the gross domestic product by 1 to 5% in developing countries experiencing rapid economic growth. Remember that the same is true for injuries. An additional 1 to 2% of the gross domestic product is lost due to injuries.
But it is more than the gross domestic product that is affected. The socio-economic impact of these diseases and injuries can put an enormous strain on families, driving households below the poverty line.
From the social impact, it is the stigma, first of all, and the restriction of a lot of social activities. Also, it is the time consuming by the patient and his family or her family to go to the health center or to the hospital. Also, it is out of the work or out of the school. It has a lot of social impact.
But there are workable, affordable solutions to prevent up to 50% of these premature deaths and disabilities, such as raising taxes on tobacco products, restricting tobacco use by banning advertising, and helping those who use those products to stop. Furthermore, encouraging people to eat more fruits and vegetables and be physically active at least 30 minutes a day can reduce risk. Additional lives can be saved through effective implementation of road safety laws. These policies and programs can be delivered in communities, schools, and workplaces.
Medical professionals have been encouraged for tobacco cessation for themselves and also for the patients they are taking care of.
Early detection, screenings and treatment in primary healthcare settings are also essential. Reducing risk factors and designing primary healthcare systems to screen for and treat these diseases earlier can lessen the impact on families and society. But effective public health responses require strong partnerships. In response, the World Health Organization is launching the Global Noncommunicable Disease Network, a collaboration involving countries, United Nations agencies, non-governmental organizations, academia and the business community.
The goals in Global NCD Network are threefold. One is to increase focus on non-communicable diseases through collective advocacy. Two is to increase resource availability. And three, to catalyze effective multi-stakeholder action, particularly at the country level. We believe that this network will help all actors to work together and to do their part to save millions of lives.
But to be successful, countries will still need financial assistance from development aid agencies.
The problem is that these requests from developing countries to help them in this exercise remain largely unanswered by the international community because these problems are beyond those targeted by the UN Millennium Development Goals.
If the prevention and control of these diseases are not included in the Millennium Development Goals, their devastating impact on health and economies could prevent the achievement of the MDGs. It is time now to consider indicators for non-communicable diseases and injuries during the 2010 MDG review process. By doing so, we have the potential to reduce poverty and prevent 14 million premature deaths in developing countries each year from non-communicable diseases.